a weekly show hosted by ENT specialist Dr. Sujana Chandrasekhar and General Surgeon Dr. Marina Kurian. They'll be joined by guest experts to discuss an array of newsworthy medical and health issues. You're invited to ask the doctors anything. The physicians and their guests' views are their own and do not represent any institution. Please contact your doctor for any personal questions. Please hit share and join us live on Facebook, Twitter, and YouTube at She's On Call, hashtag She's On Call. Please welcome our hosts.
Hi, everybody. I'm Dr. Sujana Chandrasekhar. I'm an ear, nose, and throat surgeon, and I practice in Midtown Manhattan and in Wayne, New Jersey with ENT and Allergy Associates. My subspecialty is in ear surgery and surgery of the skull base. And I'm really happy to be on this show, and I'd like you to meet my co-host.
Hi, everyone. I'm Dr. Marina Kurian. I'm a general surgeon, and I do a lot of minimally invasive or laparoscopic surgery. I do weight loss surgery, hernia, foregut, and I do all that in New York City. And it's really a pleasure to be able to join a very close friend of mine, Dr. Chandrasekhar. We've known each other since we were kids, to start this show.
We want to thank you all for tuning in. You can watch us live on Facebook, on Twitter, on YouTube. And please like and share and invite your friends. We really are looking forward to a great show. We're going to talk amongst ourselves a little bit. We're going to talk about some of the most pressing medical news of the week. And then we'll have two amazing guests on as well. So Marina, want to talk about why we decided to start this show?
Yeah, so, one thing we learned during this pandemic is that people are getting information, whether it's good information, bad information. And actually, Sujana had this great idea, like, let's do a show talking about medical topics and give people good information and some place that they can trust. And I think that based on what we hear from our patients and how successful our practices are, that people do understand what it is that we're sharing with them, that they feel comfortable, and that we are trusted by many. And certainly, this is an excellent opportunity and way to share our knowledge and actually learn from our incredible guests that we have on every week as well, so that we can share this information with the public. And I think that it's going to be topical. We also decided to call it She's On Call for a variety of reasons. And first and foremost, it's just that, I'm guilty of this too. I don't know if you are, Sujana. So I'll be like, my patients are like, I'm going to go see my primary care doctor. And I'm like, oh, what's his name? And then I think to myself, or is it a woman? And so I think She's On Call is just to let people know that women physicians abound, and we're here to answer your questions.
We are 50%, over 50% of medical students are women now. And that's a sea change. I mean, you and I aren't that old, and we were very much the minority in our medical school classes. I have to tell you, my mother in her medical school class in India was part of that 50-50. So there are different parts of the world where gender equality is more or less, depending on where you are. But, 50% of our medical students are women, but very few of our leaders are women. So very few department chairs or deans, very few sort of talking heads on television are women physicians. And I think we lose out when we don't hear from everyone in the field. And we lose out when we don't hear from people whose experiences may be different and who bring something different to the table. So we are on call. We're physicians. So She's on call 24 hours a day for patients and families. But we're also on call for our communities. So, you and I know that we get lots of questions from people we know and people we don't know about things that we may or may not have expertise in, but relate to medicine. So, Friday night, I got asked about urinary tract infection in an older person, a friend of mine's mother. And then yesterday night, I got an email from a friend because her mother, who lives somewhere else, has some bleeding in the front of her neck. And, I think one of the joys of being a physician is not only taking care of the patient in front of us, but being able to provide rational and kind and correct advice to people who are not particularly our patients. And I think you shared a great story with me.
Yeah, we were talking about this earlier that, we get asked, and we call it the curbside consult for everyone else. And I do to other doctors. I was actually in our morbidity and mortality conference, just sitting there, and I felt something on my arm, and I was like and I'm like, oh my God, I got these lumps under my arm. And I happened to be sitting next to my colleague who's a melanoma expert. And I'm like, hey, can you just look at this? You think this is bad? And he's like, no, it's just a calcium deposit. I was like, okay. Because, sometimes even though you're a doctor, you're like, what is that? So I asked that. And then another thing was we get curbsided everywhere. I got to go backstage at one of these rock shows back in the 80s. And it was, it was cool to be backstage, and we met the band players, and they were like, oh, what do you do? And I was a surgical resident at the time. And I told the bass player, I'm like, hey, I'm a surgical resident. He's like, oh, you're a doctor. Can you look at this thing on my back? I'm like, where? Like right here? He's like, yeah. So he lifts his shirt up so I can see, what he had. And I was like, okay, it was just like a little fatty tumor. I'm like, no hurry here. You don't have to do anything about this right now. You're okay. But that was a good consult in the middle of a bar. So funny.
That is one of the most cool doctor stories ever, right? Like, not only were you at a concert, which can we remember going to concerts, but you got to go backstage and you got to see a musician's back.
That wasn't really exciting. I was like, really? Okay, I'll do it. Like, okay.
And after the show, kind of sweaty, I bet. So, we have people.
I don't remember that much detail, thank God. But it was just a funny thing. Like, we get a curbside anywhere. Totally.
So we have people watching us from all over. Thank you guys so much for tuning in. Ermine from Finland, you're very kind. She says, I was always on call for the community. I love it. I have to tell you, and I know, Marina, you feel the same way. I don't think in medical school we realized what a calling this was. And we wanted to be doctors, and we wanted to help people, and we wanted to use our brains and our hands in a certain way. But I don't think we realized the positive effect we could have on those around us. And I think it's really a humbling and joyous thing.
That phrase, be the change you want to see, right? And so I think also having, you had your mom as a role model and your father, both doctors. My mom is a nurse in healthcare, but, when you think about being a surgeon, both of us, we had no idea we're surgeons or not. I mean, that's not like the first choice, right? I remember when I told my dad, I'm like, hey, I'm going to be a doctor. And then when we went through med school and I was like, I'm going to be a surgeon, they're like, why don't you do something easy? And of course, if there are any pediatricians listening out there, I'm sorry. I was like, they were like, why don't you do pediatrics? And I was like, because that's not easy. That's hard.
My dad, the ENT surgeon's response was, ENT? Why don't you do dermatology or radiology so you can have a family? So 4 kids later, I'm an ENT surgeon with a family. But I think it's perceptions, right? Perceptions are very different, and time was different then.
Yeah. I think let's talk about the show a little bit. Like today, we want to get through, there was a great article recently about how to reopen and start our lives again through the pandemic. So we want to touch base on that because it was written by 4 infectious disease doctors, and they had a great strategy for what are the different levels. And this was up to level 9. Of course, bars and music concert, very dangerous. So they're not happening yet, but these are some of the other levels of contracting COVID, what's safe, what are safer than, level 9 or level 10, which would be, for healthcare workers going into a COVID positive patient's room, that type of thing. Sujana, you want to just go through this a little?
Yeah, so I really do. I think people are tired of social distancing and they're tired of being in quarantine. If you guys want to take a screen grab of this, I think this is actually quite a helpful bit of information that came out. It was based on interviews of 4 infectious disease doctors in Michigan. So it's not data driven, but it's experienced opinion, and I think holds a great deal of validity. You know, COVID's not gone, right? COVID's still here. In New York and New Jersey, we have certainly not only flattened the curve, but dramatically reduced the number of cases because of the strict quarantine, because of the kind of care that citizens are taking not to infect each other. But there are 25 states in the United States where the numbers are rising, and 4 states in which the numbers didn't even fall, not even for a second. And they're increasing exponentially. And we're looking at, unfortunately, 7.5 million cases worldwide, 2.1 million cases that we know of in the United States, 115,000 deaths in the United States. And we are, you know, the leaderboard around the world. We are followed closely by Brazil, by Russia, by India, and by the United Kingdom. But certainly this remains a worldwide issue. So how do we re-enter life? How do we go back to work? How do we go to see our doctor? How do we go out to restaurants? You know, how do we live? So these infectious disease doctors who were interviewed really had some great advice. They said, consider these 5 elements. Consider whether your activity is inside or outside, with outside being safer. Consider whether you're going to be close to others or distant from them. 6 feet is the correct distance, or any number of feet other than 0. How much exposure time are you going to have? We saw a lot of healthcare workers get sick because of the constant exposure to sick patients. What is the likelihood that the people around you are complying? So what's the likelihood they're going to be wearing masks and staying away if they're sick and keeping their distance? And then what is your personal risk? Are you pretty much a healthy person? Do you have some underlying medical disease? And then they talk about different activities. So, you know, number 1, the lowest risk is getting takeout from a restaurant and playing tennis. So you can play singles, you can play doubles. Many of my friends ask me, can I go back to playing tennis? Can I handle the ball? And I'm like, sure, handle the ball. Don't lick the ball, but certainly you can play. And at the end of your game, you can either wash up for 20 seconds with soap and hot water, or you can use Purell and you can go about your day.
Yeah, I think those are great points. And when you're like, lick the ball, I'm thinking, just act like the tennis ball was just in the dog's mouth. You're pretty much not going to want to put up too much. It's so exciting to have 2 wonderful guests this week on our inaugural show. So Dr. Dara Kass is an ER doctor, and she's also the founder of FeminEM, which is a wonderful organization. We can ask Dara about it, but they're doing a lot of education, and it's also a resource for women physicians, and in particular, emergency room physicians. And it really served, I think, as a turning point for a lot of what we're experiencing in medicine.
And our second guest today is Dr. Hafiah Eltihar, and she is a 3rd-year resident in ear, nose, and throat surgery at Rutgers-New Jersey Medical School. And we're very excited to have her as an up-and-coming physician and future leader in medicine and surgery. And we are going to talk to both of our guests about not just their lives in general, but their experiences during COVID and how we can start opening up safely.
That's perfect. And so maybe we can have Hafiah come on right now.
You know, I think the bottom line. Hi, Hafiah.
Hi.
Nice
So
to see
great
you.
to have you.
And I think Dara's available. So,
Yay! Hi, Dara.
hi, Dara. So happy to see both of you.
Trying to use a fancy camera, which never works in real time.
It's true. I've just given up and I use my webcam. That's it. You guys do the thing where you put the little, when you're using it, are you worried about like somebody watching you? So you put the piece of paper over it? I don't. That doesn't mean anyone should have it, by the way.
I have a slider.
Oh, you do? Oh, that's cool. That is cool.
Yeah.
So welcome to the show. We're so excited to have you both. And, part of this is, we're interested in getting your takes on what's going to happen when we reopen society, which is happening. Like New York City is phase 1 right now, and we hopefully will be the phase 2 by July. I originally thought it was 2 weeks. I was excited, but now it's a little longer. So, and also I don't know what's happening in Jersey, Hafiah.
So as Dr. Chandrasekhar mentioned, the numbers in the hospital definitely have decreased. I, at the peak of the pandemic, was working at Hackensack University Medical Center, and the ENT program at Rutgers University, we were redeployed to the SICU, the surgical ICU, as well as step down unit. And then I also did some shifts, night shifts in the ICU at St. Barnabas Medical Center, helping out in the COVID ward. And it was definitely a very interesting time. I felt very rewarded, helping people that were really in need. At the same time, it was pretty depressing as well, seeing a lot of people suffering and they didn't have their families at bedside. And I couldn't imagine being in that position. So I do believe that, with us going through the phase 1 and phase 2 of reopening, we definitely need to continue to take the necessary precautions to protect ourselves. I know everyone's very eager to get out. I am myself. I'm a very social person, very extroverted, and I enjoy just the company of others. So I know that it'll be very difficult for most of us to kind of get back into the swing of being, in the public and back into our normal social settings, and also having to continue to wear masks and take the extra precautions that we didn't have to in the past pre-COVID. But I definitely think that it's very necessary. We don't want to see the spike in the numbers of people being critically ill and also dying because we aren't doing our part. So I'm a huge advocate for getting back out there, but I definitely think that we have to be very careful and continue to protect ourselves. Wash our hands, as you all mentioned, wear our masks, and keep our distance.
Dara, what are you seeing now in the emergency room?
So we've actually seen probably for almost 6 weeks decrease in the number of cases in the ERs, which is really related to the work that the New Yorkers have been doing on social distancing and mask wearing, even amongst a re-expansion and open up of the economy, which has been remarkable, I think. Obviously, I don't know if anyone here knows this, but I actually had the coronavirus myself. And that was a really eye-opening experience for me to really feel a sense of solidarity with my patients and be able to understand the symptoms they were coming to, even if they weren't necessarily needing to be admitted to the hospital. So I now get to, convey that I understand what it's like. And we see really the fewer number of patients in the ER, and we're able to take really good care of them because now we know this disease much better than we did in the very beginning. In the beginning in New York, it was a tidal wave. We got so many patients so fast. We had to redeploy everybody wherever we could. Everything became an ICU. And now we're much more back to a normal status quo in New York. And I'm optimistic that the work we've done and the lessons we've learned will help us reopen safely and consistently so we can ebb and flow in a way that's really mostly productive and forward moving, as opposed to what we're seeing in some states that really opened up before they had either their disease process under control or their healthcare system under control. And now they're really kind of still caught a little bit off guard with an increasing, almost exponential number of cases in certain places.
So, Dara, thank you so much. I think my hat's off to both of you, because I think that the tidal wave, as you said, is the right metaphor for this. This was crazy. We were drowning as physicians, as nurses, as healthcare workers, as first responders. But now, we're seeing it less in New York and New Jersey, and it's 100% due to our population, our citizens, caring for each other by wearing masks, by socially distancing, by being respectful of the pre-infectious nature of contagion. But I'm wondering, Dara, if you don't mind sharing with our listeners, what signs and symptoms should they look for? You know, both ER and ENT tend to be very first line for many of the signs and symptoms that people are looking for. So when should they be concerned, and what should they do?
So actually, the advice I give now is the advice I give now is very different than the advice I gave in the very beginning. The advice I give now is if you have any concern that you have the coronavirus or even have been exposed to the coronavirus, please go get tested. Because the best case scenario is a testing rate that's positive of less than 1%, in which case testing is available and ready, and we're finding all these very early symptomatic cases and really isolating people early on so they don't infect other people. Remembering that a lot of the attack mode for this virus is in isolating and identifying cases early on, and then having them not be contagious to other people. So the mask wearing helps us with that early phase, right? Before you have symptoms or even in the first day of symptoms. And those symptoms really are, a light cough, really a cough that's kind of a superficial cough. Maybe you have a fever up to like 101 or 100.5. Maybe you have some shortness of breath that catches you off guard. A lot of people had this sense of taste and smell that was off. I had that and I didn't know what it was. I thought I just was not having an affinity for coffee for a couple of days. And that's actually been a pretty non-specific, but early on calling card for this virus. Other things are muscle aches, fatigue. So if you feel like you ran a marathon, but you really didn't, or if you're having a difficult time walking upstairs for the first time in a while, these are really symptoms that may seem odd to you. That would be a reason to go get tested. And remember that testing and finding out you're negative is not wasting a test. A lot of people are worried about that. And in New York City and in our surrounding tri-state area, our testing is abundant enough that you should get tested whenever and wherever you're concerned about being exposed or symptomatic.
So Dara, Matt Schifrin from New York and New Jersey area is writing in, what were your symptoms? So you look terrific, and I hope you had a full recovery. I know I have friends who had not hospitalized disease, but they're still having some trouble with full breaths. They're still having muscle weakness. They're still having some fatigue, although they're back at work. So what kind of symptoms did you have, and what do you think the recovery process probably looks like for people?
So my symptoms were actually exactly the ones I tell people to look out for. So I had worked the weekend in the ER and I'd been wearing PPE, and I probably just wiped the surface and then my face right away after seeing a patient. I woke up on a Monday morning and I couldn't really walk, and I thought it was just because the virus had been very busy in New York for the week and I'd worked really hard, and I just thought I was, out of shape. And then I realized that I was tired. I took a nap in the middle of the day, which I always claim to want to do, but never actually succeed in doing. But I was able to take that nap. And then by a day or two later, I really had this cough that if I had spoken, and I do a lot of talking, and I socially and professionally, and then I was seeing a lot of patients on telemedicine, and I realized that in the middle of every visit, I would be like, cough. And I would see myself on camera, and the patients would be like, "Doctor, are you okay?" And after a couple of those visits, I said, oh, maybe I need to be checked out. And I went and did a telemedicine visit myself. And then I went and got swabbed, and I was positive on a Thursday. So it was about 2.5 days of me being what we would call kind of pre-symptomatic / early symptoms, where I kind of wasn't sure what was going on. And these are the days that we really want people to wear a mask. And I remember the very last day I didn't wear a mask in public was the day before I got tested. I went to Rite Aid to get some cough medicine. And I wasn't really sure what was going on, but I wanted to have it prepared just in case. And I kind of can't let go of the guilt of the opportunity. Like, maybe I don't think I got in contact with anyone. People were mostly at home. But I remember that that's the feeling I don't want people having, that they find out they're positive the next day or even 2 days later, and they realize they did go outside without a mask, and maybe they exposed one more person. I was symptomatic for about 8 days, where I was mostly home napping, taking, Tylenol, Motrin. I was able to still see patients on telemedicine because I was able to stay home. I monitored my oxygen and my, breathing with a pulse ox, which we recommend people to have at home if they can, just to have some data. So it goes on your finger and it gives you a number of how your oxygen level is. And it really kind of sets you with some number that makes you know if you should be worried or not worried. And then about 8-9 days later, I started feeling better. Now we're really wanting people to recommend that they would get a negative test in theory before they really engage closely with people outside of wearing a mask. And so I waited. I tested negative about 4 weeks later, but that was the first time I could get a second test because this was very early on. I still have residual shortness of breath or, like a chest pain in random times. And I don't know if that's related to the coronavirus or just the regular life fatigue that I have. But I blame the coronavirus, and I think a lot of people will for a long time. And I had a lot of friends who were admitted and actually intubated, went to the ICU. A fair number of people in our healthcare community did unfortunately pass away from this. And so it's been a really roller coaster experience emotionally for a lot of people in my world. But fortunately for me, I was relatively uncomplicated and able to return to work pretty quickly.
It's amazing. I would ask both Dara and Hafiah if what the impact has been a little bit emotionally, because as you said, Dara, you had friends intubated, colleagues, and when you hear the numbers of people, and intubated means that they were on a ventilator in the ICU, just the sickest form of COVID that you can have. And so when you hear that, you then look at who's coming out of the ICU, and thankfully a lot of our colleagues did come out, but some of our other colleagues passed. And just what's that emotional toll? Because Hafiah, you were in the ICU taking care of these patients, as you said, where you were the sort of the last human contact that they might have had. And you're holding, everybody's seen all the images of people holding iPads up for Facebook or FaceTime with their families when they're sick in the hospital. So it was terrible for the patients, but it was also heartbreaking, especially because we're all caregivers.
Yeah, I would say for me, it definitely took an emotional toll on me. There was one night in particular that was especially hard. I had just started a shift at St. Barnabas Medical Center. It was my evening shift that I was going to cover nights, or I did cover nights, and that night for. And I got there, and there was this young patient who, at the beginning of the shift, things looked great. We were going to transfer her out of the ICU because things were kind of on the up and up, and we were really positive about the patient's progress. And unfortunately, just as the night continued on, the status of that patient just continued to deteriorate. And I remember the patient looking up at me and actually saying or asking me, "Am I going to die from this?" And that was really, really hard. I couldn't imagine it being one of my loved ones in the hospital, not able to have me there at the bedside to comfort them, let them know that I'm there. Hope, and I think that having your family or patients having family around really gives them hope. And I think that has been or was the toughest part for me in the ICU, is just seeing those patients there pretty much alone, other than the healthcare workers there at their side. So I try to be that supportive person, but I know that it doesn't compare to actually having your loved one there.
Hafiah, I'm tearing up listening to you, because I remember being a trainee, and I remember how hard it was to learn and work my area of subspecialty, my ear, nose, and throat surgery, how difficult it was to dedicate myself entirely to that. And I find that the trainees now, this season, have unfortunately had the added burden of the emotional and intellectual challenge of learning about a disease that nobody knows anything about, and that we're learning about day to day, minute to minute, and then dealing with the emotional difficulties. And I really applaud you. And I wonder what you and your fellow residents used to try to get through some of that emotional difficulty, which was both taking care of very sick and even dying patients in isolation, but also feeling like, oh my gosh, I only have this much time to learn about ENT. When am I going to do that? So how did you navigate that, or how did you and your friends navigate that?
So a couple of things. As far as trying to, I guess, stay in tune with ENT, I utilize my evenings in the surgical ICU and in the COVID ward when things were pretty quiet to read Pasha, read about ENT. And I honestly felt like it kind of kept me grounded because it was such a stressful and honestly emotionally traumatic experience that I felt like I needed something to kind of hold on to in a sense during those nights to kind of remind myself of why I chose to be, there in the first place. And so that was something that kind of gave me comfort. But I would definitely say more than anything, having the support of my family, my friends, I always had people checking on me, asking me how was I doing, whether it was my family back home in Sudan, or my family in Alabama. I had several attendings reach out and ask, like, are you okay? Do you need any sort of emotional support? And venting to me was, something that was very therapeutic. Again, having people that I could call, having friends that I could text in the middle of the night saying, my gosh, this is really rough. Or, this was really rewarding. One patient is doing very well and they're, being sent out of the ICU.
It is. Did you guys see that? I think I was on Twitter. There was some resident team that every time they extubated a patient, they would do an extubation dance, and they posted these dances, and I just loved it because it's like they were celebrating, this. It's a success, and I think the thing about COVID that we've all learned, or we call it COVID or Corona or whatever, right, is that we just don't know. And we're learning. And as I said before, there's so much science and research that's coming out of this. And it's such an incredible step forward for research. And just, I'm just so, I would love to be involved in that research, but I'm not, because this is not what I do, right? But I just think it's just such a trove of information that it's going to be, the things we learn and the things that we learn incidentally are going to be so amazing, right? That just like, this didn't work for Corona, but now I think it's going to work for influenza, right? So it's good. It's such an amazing time, but it's also a super hard time. But I think it might be a great way to segue back to how we're going to get out,
right?
Especially the summer.
Well, I think that's actually, for me, that's exactly the point, right? We've been able to lead with humility, at least those of us that have tried to really be leaders in this moment, to say, these are the things we know and these are the things we don't know, but we all need to live and move forward, right? But I think also a lot of us, I'm a parent of 3 kids. So in the middle of all of this, I've also had to figure out how to do homeschooling and get them engaged and keep them athletic and figure out what it looks like in the world to have them not understand why they're at home, why are they wearing masks. One of my kids had a liver transplant when he was 2 years old to make it even more complicated. But the reason I bring that up is because as we re-engage over the summer, a lot of the things we think about is what are reasonable risks we need to take as a community? What are things that are just not reasonable risks? So one of the things I talk about a lot is closed space singing, whether it's at church or a concert, is not a reasonable risk to take right now. But if you want to go to an outdoor band shell and listen to an orchestra, that's probably a good idea, right? And so I think that as we reopen, I talk to my children about activities that they can partake in that are really rewarding for them, that are engaging and athletic, that keep them socially engaged with other people, but also moderate the risk that they have so they're not going to in-person overnight camp in a bunk with 12 kids sleeping like sardines this summer because we just don't know enough about the virus.
I think those are great points. I think people have a lot of concerns about, one, resuming work, because many people have been out of work for 2 or 3 months, and some have been fortunate to work remotely on the computer and others not. But, people like to go to work. It's always nice to go to work and interact with your colleagues. So I think one of the questions that Sherry Preston, who's watching from New Jersey, asked was, what is happening? Like, how are we going to be back in offices, back maybe seeing our doctors in their offices or our dentists in their offices? How are we going back to some sort of normal semblance of life while maintaining these norms? And I wonder if, Hafiah, you have some ideas on what people can do to get back into the work atmosphere, but in a safe way. And I'm wondering if we could just put up that graphic again while Hafiah is talking.
Yeah, I personally feel, number one, like as they have listed, playing tennis, getting out, being active. Even for myself, even during the peak of Corona, the gyms were closed, but I took it upon myself to go running outside. I think staying healthy, staying active are definitely ways to, improve your emotional well-being, physical well-being, and just, it serves as a great immune booster as well. So I think that, people signing up for virtual, 5Ks or marathons or whatever, I mean, that's definitely a way to continue to maintain the social distancing, but still be active in a very kind of social way as well, because it's virtual and other people can join. I think that, again, as I said, I'm an extrovert and I love being around others. I definitely think that we should continue to do that. And, if you can go out to dinner and say some of the restaurants open up their outdoor patios and you can, small groups get together and go have dinner, I think that's a very appropriate way to kind of, get back into kind of, I guess, normalizing our social lives again. Again, it's not going to be 100% for a while, but I definitely think that there are things that we can do, as stated, that'll help us kind of get there and enjoy,
Dara, I want to ask you, I know what I'm doing in my office, right? So when I'm back in the office, we're trying to limit it to like 1 or 2 people every 15 minutes. And then trying to move the patients out. The patients are going to make their appointments by phone, because they're not going to stand in front of the desk, et cetera. And everyone's wearing a mask. And if they don't have a mask, we give them one. How are the ERs doing this?
So we're actually doing really well. I think that every patient that comes into the emergency department has a mask on, and we've been taking care of, right now, I would say I worked yesterday in the ER and the day before, and the patients I took care of were not there for coronavirus symptoms. And I don't feel that they got any higher risks for coming in for being seen in our ER being exposed. We're able to really kind of put the patients that are coming with respiratory symptoms or even high level illness away from patients that are coming in for lower risk things. And that's because of not just the volume of patients, but the time we've had to really plan ahead. Right. I think doctors' offices, dentist offices are actually in a lot of ways lower risk than other non-planned gatherings. Right. One of the things that's really important about this moment is to remember that all of our moves need to be deliberate. So it means that we need to know when we're going somebody, where we're going there, how long we're staying there for, what's our interaction. And then we need to get home, or certainly moving on our way as soon as possible. In the middle of all this, one of my children sprained his ankle. It was really like a fracture of his growth plate. So he had to go to the orthopedist in the middle of the coronavirus. And he had really otherwise been at home. This was a scooter accident because, of course, he decided to scoot in the park. And, the office was really remarkable. The same thing for them. Everyone was masked up. We registered ahead of time. We went right into the office. They were seeing a fraction of the number of patients they had seen before, but really responsibly. And ironically, the doctors got to take more time with their patients because they were scheduled so much further apart. And so I think that it's an interesting time to reframe what visits can be done on telemedicine versus what visits have to be done in person. There are going to be and continue to be visits that have to be done in person. But there are a lot of things that we can do, even in emergency care and urgent care, that we can screen patients, via telemedicine and really get people to the right doctor once, as opposed to what we've done in the past, which is farming people to appointment after appointment, not really knowing where they need to end up. So I think the emergency departments are doing great. I think doctors' offices are doing great. I think we'll get to dentists and orthodontists, which is a big thing in my world very soon. And then, that's important for a sustained economy and a sustained healthcare system.
You said 2 things. One, of course, your kids had to go to see a doctor, right? So I had to take my father to the emergency room because I knew he has COPD, which is a lung issue, and it was having an exacerbation. And he hadn't been out of the house. There was no way he was positive for corona, but I had to take him to the ER, and then they, put us in a room, isolation room, because it was a respiratory issue. He finally this was back when it would take 2 days for the test results to get back. So 2 days later, we knew he was negative, but I'd already taken him home. But the other thing you said, which I think everyone should be aware of, because I've taken my kid to the doctor and the orthopedist for a sprained, a bone bruise, and she broke her finger. Dara, didn't I look at you and ask specific questions about how your son had his injury, right? Because that is a separate thing, especially, during coronavirus, there's domestic violence was up and all those other things. But even when it's not corona, if your kid gets a sprain, they always kind of look at you and ask you, like, how did this happen? So I was thinking, in addition to that, you're taking your kid in during corona crisis, but they're also like, Dr. Kass, how did this exactly happen to your child?
But I want to make sure we understand. It's like one of the things you said about your dad is we had a very reasonable period of time where people avoided the ER at all costs. And I had started sending friends into the ER for things like blood clots and, infections that needed IV antibiotics. And I was like, listen, if you need to seek emergency care, and this will continue to happen in cities not like New York and New Jersey. So if you're watching this and you're in Arizona, and Arizona is really in a bad place as far as coronavirus right now in some of their emergency departments and ICUs, remember that if you have to seek care, do a telemedicine visit first if you can. But if they tell you to go to the ER, please go. Realize that we can walk and chew gum at the same time, and we need to make sure that our heart attacks and our strokes and our abscesses and our other infections are taken care of the right way, even amidst a coronavirus pandemic. And I need patients to hear that all over the country, because we're now on the other side of it in New York, and I hope we stay there. But I know that a lot of states, especially like Alabama, Hafiah, where you are, it's going to get really, really bad, and it may not get better depending on how the leadership of the state goes.
I think the point of we are still doctors, we are still nurses, we are still healthcare workers who wish to care for all of your health is really important. I want to say there are only about 17 minutes left, although I could talk to you ladies for hours. We've been getting comments pouring in from all over the place. We had people commenting from Finland, people commenting from India, people commenting from New Orleans, people commenting from the Carolinas. One of the questions, and of course, I went to Stuyvesant High School, which no matter how old I get, I will always be very proud of where I went to high school.
Me too.
Did too, right? Marina did too. And Robert Hillman, who was in my class of 80 at Stuyvesant and is now in North Carolina, asks, what is contact tracing and how can it be implemented? And Mark Lee, who's another great friend that I met through digital media, is saying that he actually got trained to be a contact tracer and now is looking to implement those skills. So I think that's the one we're talking. Dara, you talked about testing, you talked about not being afraid to go to the doctor, you talked about not ignoring your symptoms, and I think Dara and Marina, you guys were perfect. My husband says whenever I get a cold, I have like pneumonia, and then meanwhile, so you had your lump looked at because the melanoma specialist had to look at you, whereas Dara went and took a nap and went to Duane Reade and finally realized she has
lost her taste for coffee. Dara Kass, I don't think so.
It was I was in denial. That's all there is to it.
Yeah, and denial is not just a river in Egypt, right? So
right,
we all know about this. But I'm wondering, Hafiah, if you can talk to our listeners and our viewers about contact tracing and why that's important and what that means. Like, do people really have to go door to door to sick people, or is there something else that they need to understand about that process?
I don't necessarily think that people have to go door to door to sick patients, but I do think that, if people can kind of remember, say for example, if they are seeking medical care because they're symptomatic, and they can say, well, these were the last individuals that I was around, that could provide some information that could help as far as maybe reaching out to certain individuals and saying, hey, be on the lookout, that sort of thing, I think could be, of help.
And I think the countries where we've seen amazing results, like New Zealand had very intense contact tracing. Germany had very intense contact tracing. Now, they all happen to be led by women, but
I saw that.
An issue for a different show. Roberta, I'm so happy to hear that your granddaughter's at Stuyvesant. Stuyvesant is the greatest, I have to say. Sorry.
There are a lot of great schools.
I went to Midwood. I'm just putting it out there. I'm not going to sit and have this happen and deteriorate this conversation so much. Okay.
Where'd you go, Dara?
I went to Midwood in Brooklyn.
Oh,
Yeah,
excellent.
so
All right.
there are great high schools all over the country.
Yeah, we're good.
I totally forgot. I mean, Sujana and I have been childhood friends. I totally forgot when I got to Stuyt. I mean, I knew you went there, but like I just didn't recall. And now I was like, oh yes, we went to Stuyt.
Yes.
Yeah, I was a ninth grader. She was
sister.
a senior, and I knew her, so she was nice to me. It was
Yeah, and your sister was older than me, and she was nice to me, which is why I paid it back.
Yeah,
and I
that
have
was
to
great.
say, thinking about people who inspire us, Marina's mom was a nurse at Mount Sinai, where I was a medical student, and I learned a great deal of empathy and compassion and patience from your mom.
Yeah,
Who
my mom.
really could be in the eye of a tornado that was going on and just keep the goal in mind. And I think that's what people come to physicians and nurses and healthcare workers for, so that we can, in fact, keep the goal in mind and keep the patient at the center of what we're doing.
I want to remind our viewers that, you know, you can follow us. She's on Call on Facebook, Twitter, YouTube. Please like and share, just so, because we're definitely going to be coming back next week, again, next Sunday, 11 to 12. And at the end of the show, we'll show you our next guest. And we would love for you to join us in this conversation, because I think it's fun for us. As you can see, we're having a great time. Hopefully we're making a lot of great information for you guys, but also making you laugh, because, you know, not everything's so serious. We are talking about COVID. That is a totally serious topic, but there's ways to deal with illness and sometimes a little bit of giving it perspective. And there's joy in medicine, and there's sorrow, but there's the joy and the laughter has to be there for like it to be best medicine, really.
Marina, can I just make contact tracing for 1 second?
Absolutely.
Okay. So every state is doing things differently, and this is actually part of the 50 states in DC in the United States of America. So in New York State, one of the things we're doing is actually investing in contact tracers and in the process of contact tracing. And so we want people to know that if your phone rings and it is an unknown number, it may actually be a contact tracer calling you and asking you if you have symptoms or telling you you've been exposed. And that's where a lot of the training for contact tracers has happened. So we want more states to have formal contact tracing programs. One of the things I say to people is, if your community or state does not have a formal contact tracing program, that's kind of what Hafiah was talking about, where you are your own contact tracer. So you need to make sure that you know who you've contacted and who you've spoken to, and really call them after you find out that either you or a family member is positive. But there are developing, thank God, in regionalities, formal contact tracing programs that will call you, not necessarily knock on your door. Just let you know that you may have been exposed and that you may need to get tested. And we look forward to seeing those programs everywhere, because the 3 tenets of expanding safely are going to be testing, tracing, and isolating. So making sure that people that know that they have been exposed or that they're positive isolate themselves until there's been a reasonable period of time waiting for symptoms to start, or that they are negative with either multiple tests or just for a period of time.
No, thank you. That's such important information. And I think, you know, do you guys not wonder that if we're all wearing masks and we go out and we are, if we're feeling sick, we stay home and do all these things, that don't you feel like we're going to actually change perhaps our flu season and our cold season?
Yeah.
Right? There's going to be some good coming out of this, I think.
A lot. We don't see, I mean, I had a patient with strep throat yesterday for the first time in weeks, right? And strep itself is generally, as our ENT doctor will tell you, not always contagious, right? It sometimes can be just a manifestation of what you have in that lives in your body. But we have not seen a lot of other respiratory viruses. Even we saw like a massive downswap of the flu virus in March and April because of the masks. Mm-hmm. And we've also seen, and this is, I think, really inspiring, is this Missouri hairdresser case, I think, is so fascinating, where you had 2 hairdressers that were symptomatic and in close contact with people. 140 people were exposed in theory, but the hairdresser and the customer were both wearing masks, and none of them got the coronavirus. None. Which I think is so exciting as far as an opportunity to do something without waiting for a vaccine or more medication, because prevention in this case is so key on the idea of getting back to normal, engaging with our communities, and getting back to an economy that's going to move forward.
And that's a critical point, right? Livelihoods of so many different, you know, in New York, what do they say about restaurants? It's location, location, location. But really now, when so many of them have shuttered their doors. It's going to be a completely different landscape. And I think it's so critical that we do restart the world has to restart.
You know, I think it's not that hard to wear a mask, and it's not that hard to care about other people in your community. And frankly, if all we need to do to get back to work and get back to life is to wear a mask and keep our distance and wash our hands, I think we're going to be okay. A lot of people are writing in, and it's so amazing to see. Laureen Looney says, awesome idea. Congratulations on our new show. Thank you. Bose George, who's writing from Eastern Long Island, says, great show. Thank you. Allison O'Connor is congratulating us on the information that all of us ladies are providing. People writing from Chicago, people writing from California, from all over the place, which is really great. I wonder, because, one of our premises for She's on Call is that even though women are present in medical school and women physicians are no longer an aberration, I think, the sort of the go-to is the male doctor. And I'm wondering if you guys might share a little bit of your journey to medicine with us. And maybe I'll ask you, Hafiah, just, how did this come about? Who are you? How'd you get here? What are your dreams? Let's know about you.
Yes. So my story is I guess a little cliche. When, I grew up always wanting to be a doctor, kind of thing. And so once I got into medical school, which I went to the Alabama College of Osteopathic Medicine and graduated there, I never really even imagined myself being a surgeon, to be honest. But I actually met an ENT after my first year of medical school and worked with him. And I fell in love. And I was like, oh my gosh, this is 100% for me. And it's interesting because most of the inspirations that I had to even become a physician and then, even a surgeon were males. They were male doctors that I kind of looked to. But, I saw that I was fully capable of doing the same and providing aid and help to those who really need it. I'm a giver at heart. And so I just knew that it was the right profession for me. But as I've gone through my journey, finishing medical school and then matching into residency, I've had the opportunity to meet several wonderful surgeons, such as you, Dr. Chandrasekhar, that have really inspired me to work hard, achieve my goal, and really kind of change the narrative. A lot of people just automatically assume, and we're all guilty of it, even myself, where if you're speaking to a patient and the patient says, oh, well, my doctor is so-and-so, you say, oh, well, what did he say? We automatically, assume that it's a male, and so we're all guilty of it. But I hope that we can all work together to change that. I'm commonly called a nurse, which nurses are amazing. I love them. I've learned so much and will continue to learn throughout my journey of training and even when I am practicing on my own. But at the same time, I do think that, society has kind of made it to where in our minds, we think that, men should be the physicians, women should be the nurses. And I'm so happy to have leaders such as you all to look to, and hopefully others that are viewing this as well will feel empowered and inspired that us women, we make a huge difference in healthcare. And we're very important. So I'm excited to have this opportunity, and I hope that I have inspired someone out there.
That's wonderful. Dara, your journey?
Oh, I'm old now, so it takes a little longer.
Not as old as me.
Too close. So actually, so my mom's a nurse too, actually. So both of you guys mentioned how your parents were inspiring and in the healthcare field. My mom was a nurse, and she actually worked in the ER at a trauma center when I was a kid. And I thought that was the coolest thing in the entire world. If in July 4th, your hand got blown off by a firecracker, I wanted to be the one to figure out how to put it back together, but not too long. I wanted to then move on to the next patient. So I, speed tracked it. It became, went to college, med school, the whole 9 yards, and went right into emergency medicine, showed up in the ER my first day at Kings County and said, as a medical student, not as a resident, and said, I'm here to be a doctor, train me. And I spent a lot of time in that ER learning incredible things from an incredible faculty. I've spent a lot of time working on gender equity in medicine and really kind of reframing the narrative around what does a doctor look like? And more importantly, how do we live as physicians with other lives? I think one of the historical mandates of physicians and really a lot of other professionals was to lean forward and go, move on without really a distraction of anything else in your life. And I think once women really hit critical mass in medicine, we started really kind of incorporating our other societal gender, based, responsibilities, and really had to reframe what does it look like to take parental leave, or what does it look like to have, to be pregnant at work, and have a hierarchy that really did not promote women, did not pay them fairly, did not really amplify their voices. And the best way for me to do that was to bring together really a community of women and have them start speaking to each other so that they could then amplify each other and really be a force to be reckoned with. And so I spent probably the last 7 or 8 years doing research on gender equity, really creating a speakers bureau for women in medicine and getting the voices of women out there, not just, women, but really then intersectional and diverse across the board, making sure that we then, our traditional physician is not just male, but he's also white, and he's, cisgender, and he is heterosexual, and he's all these things that we expect norms to look like. And so a lot of equity comes in making opportunities for people at the intersections. And that's a lot of what I've done. And I think that we've seen a reframe, and the coronavirus, to bring this all together, has really taught a lot of us about what it's like to live as a whole person. And I think schooling and homeschooling has done a great opportunity for that as well, because a lot of us have started to realize that the tasks that it took to be a parent and, a Zoom school teacher while also working from home made us realize that there were things we were missing out on, but also things that we needed to kind of make space for in the future. And so we'll see a lot more flexible working, I think, job sharing and opportunities for workplace space that will create better equitable principles, aside from a reframed healthcare work environment, reframed economy, and other kind of principles that I think will hopefully bring us closer to diversity and inclusion and long-term solutions writ large.
Well, Dara, thank you guys so much. Both you and Hafiah have been fantastic guests on our first show, and we really appreciate it. Those of you who are watching, you can share this link. That'd be great. I'm sure you all know people that would benefit from the conversation. And I love that, Dara, you ended this on like a real powerhouse note. But I do think that equity in medicine and in healthcare is important, but it's also important in the corporate world and the lay world. So I think it's really opportune time to discuss all of that.
We've been getting a lot of comments and a lot of questions about weddings, about other events that we need to plan in our lives. I'm hoping that both Dara and Hafiah, if they don't mind, can go back into the Facebook and the Twitter and the YouTube and look at the questions, and please answer them as best you can. It's really been a treat having both of you on, and I think we've learned so much from you. The bottom line is COVID's not over. We're not over with it, but there are steps that we can do to get back to interacting with each other and being safe. And I think Dr. Kass talking about testing and tracing and
isolating.
Yeah.
I feel like
I got it.
If you say it all the time, you never forget.
Yes. Tracing and isolating is the way to go. Please wear a mask. Please
let's do the next show because we're running.
Yes. So follow our guests on, and thank you guys so much. And Marina, do you want to introduce next week's show?
Yeah, next week we're going to have Dr. Nadia Hernandez on. She is an anesthesiologist in Houston, and Dr. Lillian Lee, who is also an ENT resident, I believe, right?
Mm-hmm. Yep, at Georgetown.
In Georgetown in DC. And I want to thank our team. We have team people, and here they are. They're wonderful, fantastic, and it just made this seem so seamless. But definitely Sri Srinivasan, Rose Vandana, Julia, Shrushti, who did the design for our card. Definitely follow us. You can see where we are. It's hashtag She's on Call, and you can follow us on Facebook, Twitter, Instagram, and YouTube. And that was quite a feat to get all together. So thank you so much to our team. And
you know what? If you want to email us, please email us at docs@she'soncall.com. If you're interested in sponsorship of this show, we'd love to hear from you, but we'd also love to continue this dialogue through the week and see you again next week. Please tag and share and like and subscribe and let your friends know if you enjoyed it. And if you didn't enjoy it, tell them you did.
or tell us why you didn't, and we'll be happy to discuss that.
Yeah. Thank you so much.
Thank you so much. I enjoyed it.
Everyone. Thank you.
Bye. This is great. Thanks, Marina.
Bye.
Bye.
Take care.
Bye.